Hello, everyone. Welcome to this virtual webinar series. Thank you so much for attending. This is going to be the seventh installment in the Adolescent and Key Young Population Partnerships webinar series. The Adolescent and Young Key Populations Partnership is a joint venture of youth networks and UN agencies with the goal of strengthening the youth-led responses with respect to the needs of adolescent and young key populations under the leadership of the Youth Rise and Lighthouse Vietnam. This webinar series was conceived to support conversations and knowledge sharing amongst youth networks, activists, and advocates on topics that are important to the youth-led networks. So before we get started, I would like to address a few housekeeping rules. We invite you to introduce yourselves in the chat box. This webinar is being recorded, and by participating, you are consenting to being recorded. Recording and follow-up materials will be shared post-webinar. Please keep your mic always muted to avoid any disruption, and we will all have our Q&A session at the end of the session. Please use the Q&A button to ask your questions addressed to specific speakers. First, we'd like to introduce our host and moderator, Alicia Sanchez, the Youth Engagement Advisor at UNAIDS. Alicia Sanchez is a seasoned international development professional with extensive experience in global health. At UNAIDS, she excelled as a youth programs coordinator and in various roles focused on HIV/AIDS policy, program management, and strategic partnerships. Alicia played a key role in designing and implementing effective HIV programs, advocating for comprehensive strategies, and analyzing data to inform policies. Her work involved collaborating with governments, NGOs, and communities to tailor HIV initiatives to local needs. Alicia's expertise is in capacity building, advocacy, and evaluation has significantly advanced global health outcomes and human rights. I am passing it to you, Alicia. Welcome. Thank you for joining us.
Thank you, Bukola, for the housekeeping rules and the introduction. As Bukola said, my name is Alicia, and I'll be your moderator for today's session. So this webinar will be the first in a three-part series that aims to offer insights into the engagement mechanisms, whereby adolescents and young key populations can share experiences individually and as networks, which can influence the global HIV response. The first session in this series will focus on global health and development advocacy infrastructure. The second session will address the global financing architecture, and the third one will focus on transnational movements and partnerships. So today, we will be discussing the global health and development advocacy infrastructure from the leading lights of the global movement for youth well-being. So today's speakers will share their first-hand experiences on engagement on the strategic platforms aligned to the SDGs and the Agenda 2063, including ICPD+30, the Commission on Narcotic Drugs, CND, and the Global Fund replenishment. We have a packed program filled with learning about strategies, perspectives, and tangible frameworks that can help us to advocate for the fulfillment of the rights of adolescents and young key populations, including those in the most marginalized and constrained settings. Without further ado, I would like to introduce our speakers. First, we will have Ruby Rose Lawlor, the Executive Director at Youth Rise, a leading organization focused on advancing youth involvement in public health and drug policy reform. With extensive experience in advocacy and youth empowerment, Ruby will be discussing her insights on the advancements made in 2024 and the pivotal role of youth networks in these developments. She will also be sharing her perspectives on the broader drug reform movement and the Commission on Narcotic Drugs, and the key advocacy entry points and how existing platforms are supporting and advancing the HIV response at various levels. Next, we will have Daphne Galou, a youth advocate at Choices for Youth and Sexuality. Daphne will be sharing key themes that emerged from this year's ICPD Plus 30 dialogue in Benin, and why they are particularly significant for youth movements, policies, and programmatic decisions. And last, but certainly not least, we will have Agatha Sialendra Handam, Youth Lead Project Officer in Asia and the Pacific region. Agatha brings extensive experience as the young key population focal point and program manager at Inti Muda, Indonesia, along with significant contributions as a CCM member overseeing young key population engagement and the inclusion of Indonesian young key population priorities in the Global Fund GC7. Agatha will share the strategies and the practices that successfully promoted young key populations inclusivity and engagement in GC7. We're honored to have these three experienced youth leaders with us today, and let's get started with Ruby. Ruby, in 2024, 2024 was a landmark year for the rights-based approach to the global drug reform processes. Please share with you where we are in this process and your reflections on this historic moment. Also tell us a bit more about the role of youth networks as part of civil society in getting us to this moment. And finally, could you also share what are Youth Rise's perspectives on the broader drug reform movement? And what are the key advocacy entry points, and how the existing platforms support or advance the HIV response at global, regional, and national level? Ruby, the floor is yours.
Thank you so much, Alicia. I really appreciate the introduction and really excited for the engagement today and to be invited to speak about the global drug policy sphere and its intersections, intrinsic intersections with harm reduction and the HIV response. So I'll just explain a little bit about Youth Rise for those who aren't aware of us already. So next slide, please. Thank you. So Youth Rise is an international network of young people who use drugs and young people who are engaged in drug policy reform and harm reduction nationally in their own countries. We operate in countries in nearly every continent in the world, and we make sure that we're bringing the priorities which look different in each country depending on the criminalization of drugs, the prioritization of the youth voices, and of health and harm reduction within the country. We bring these perspectives that our members are able to give to us to global platforms that have the global drug policy developments and decision-making happening within them. Not only physically do we bring our members to these spaces to talk about the challenges that they face as young people who use drugs, we also do this through documenting their experiences and then highlighting them in these platforms. Youth Rise is mainly focused around promoting the health and human rights of young people who use drugs. And this means that we can't work on harm reduction and advancing harm reduction without also reforming the drug policies that rule us. So predominantly, as you all are aware, drug policies are surrounding criminalization of people who use drugs and also perpetuating incredible amounts of stigma and discrimination amongst our populations as well, which I think is common knowledge to us are all barriers to accessing any health or human rights, and particularly when it comes to harm reduction, which for the most part is not scaled up to match the need by any means. So next slide, please. Please also, if you want to learn more about Youth Rise, because I don't want to put so much time on that today, check out our social media channels, our website, and please reach out to us if you'd like to learn more about our organization. So in terms of what's been happening this year, it's been or in terms of the global drug policy response in general for rights-based approaches, we have a few organizations or UN based organizations that really promote and highlight harm reduction within their policies. For example, the Political Declaration on HIV/AIDS, the one in 2001 and also the one in 2016, which both stipulate that harm reduction must be essential for responding to HIV for people who use drugs and also prioritize the importance of youth-led responses as well. The harm reduction itself, the concept of harm reduction, which includes interventions such as needle and syringe exchange, opioid agonist treatment, drug checking, and goes beyond this into advocacy and awareness around drugs. All of these have been stipulated by different agencies and different civil society organizations about what the actual definition of harm reduction is. But in terms of UN agencies, the World Health Organization, UNODC, have a specific list of, and it's a limited list of what harm reduction interventions look like. So we as civil society continue in our role to push the boundaries of the limitations of what harm reduction can be into a broader and in our terms, a more youth specific and youth friendly approach to harm reduction, which is still severely lacking that focus at the global level. We also had a resolution at the Human Rights Council in 2023, which mentioned harm reduction and highlighted it as key to any policy response to drugs and in ensuring the human rights of people who use drugs. And as a result of this Human Rights Council resolution, and directly called for within the resolution, was a report by the Office of the High Commissioner on Human Rights on the intersections of drug policy and human rights, which came out last year in 2023 as well. It was fantastic to see some of the inputs that YouthRise had provided to the Office of the High Commissioner included in the report, and its own special chapter on children and youth, which we haven't previously seen. So it was great to have that recognized and for young people to be seen as a really key priority and most left behind amongst key populations, even within the drug policy reform movement and as a whole. We also had the Special Rapporteur on the Right to Health last year, or a few months ago, sorry, coming out with a report on the right to health in relation to harm reduction, which also mentions young people as one of the key priority populations to focus on. And then we had another exciting development at the CND this year. CND is the Commission on Narcotic Drugs, which is the global decision-making body on drug policy. And obviously, drug policy, harm reduction come hand in hand. And this year we had the midterm review of the kind of global guiding document on drug policy. So it was the midpoint of seeing how we're doing. That's what the meeting was focused on. And at this meeting, there was a coalition formed of 62 countries that are pro-drug policy reform with a focus on health and human rights. So this was also a huge movement or moment for us in the drug policy reform and harm reduction movement, which really showed a prioritization and a moving away from criminalization and punitive responses to drugs and a more focusing in on the health and human rights of people who use drugs and those involved in the drug trade. So that's some of the exciting recent developments that we've had, and it really seems like it's all kind of coming to a point now. It's been a long, hard effort, one that I've not been involved in for decades, as I'm a young person engaging in this work for the past 6 years. But even in the past 6 years of my advocacy, this is a huge increase in the amount of UN agencies talking about drug policy and human rights and harm reduction, and the focus of national governments in the global policy space talking about it as well. So this is really exciting. Next slide, please. I really hope I don't go over time. There's a lot to say. So despite all of these exciting developments that we're having and hearing more and more the prioritization of harm reduction, human rights, health rights for people who use drugs, when it comes to young people, it's still a highly controversial topic in the global drug policy sphere, and also nationally and regionally as well. You can recognize it. So when you talk about young people in this space, which is what YouthRise does, YouthRise goes to these global decision-making platforms, for example, the Commission on Narcotic Drugs, and we engage heavily in this space to continuously remind national governments, UN agencies, regional bodies, that young people who use drugs are being left behind. And that as much as we are prioritizing and moving forward with prioritizing the health and human rights of people who use drugs, we need to still look at the intersection of young people and to not have the focus solely be on prevention of drug use, as much as that is also important, but also look at how do we turn our harm reduction interventions into more youth-friendly harm reduction interventions? How do we fund that better? How do we tailor them to be youth-friendly? And this is probably the crux of the work that we do and the most controversial topics that we work on. But to make sure that we are doing this in a consolidated and strategic way, we do it as part of a coalition of other youth-led and youth-focused organizations that work on the intersection of drug policy, health, human rights, which is called the Paradigma Coalition. And so this coalition is YouthRise is part of it, as well as other partners from around the world, national, regional, and international partners. And we basically go to these UN spaces, strategically planning our interventions there, our side events, our statements, to ensure that we cover a wide range of topics when it comes to young people, harm reduction, overdose prevention, health rights, and the whole work. So we do this in a consolidated way. And if you want to learn more about the Paradigma Coalition, again, please reach out to YouthRise and or myself, even in the chat, and we'll try to get you linked up so you could join in the kind of global UN movement for this. Okay, next slide, please. So just to finish up on some platforms that are really supportive of the HIV response, as I mentioned already, the focus of the human rights bodies has been really influential recently for prioritizing harm reduction and drug policy reform more broadly. But when it comes to specifically the HIV response and the impact that YouthRise has been part of creating and is still seeing the impact going forward, it's within partnerships with UNAIDS, UNICEF, UNDP, and other UN agencies in the global response as part of the Adolescent and Young Key Populations Partnership, which we're here under that partnership today to talk about these. We also have been supported by these agencies when it comes to partnering up on side events or promoting our resources. YouthRise produces a lot of resources on the intersections of young people who use drugs and other identities. For example, young sex workers who use drugs in 2023 was our focus, and young people who use opioids more recently. And these really friendly UN agencies to drug policy have been really helpful in making sure that our resources go further and that at side events, they can put their name behind our work to be able to legitimize it further, which we obviously always appreciate. And this goes both ways, the partnership. We also get to give input to and lead the process of developing toolkits like the Legacy Toolkit, which is coming soon, and in the past had been the Adolescent and Young Key Populations Toolkit. And finally, we've had an incredible partnership that is only growing stronger with the UNODC HIV/AIDS section, which focuses on harm reduction primarily, and also in the same partnership with UNICEF, UNAIDS, World Health Organization, and others to develop, hopefully coming in this year or next, youth-friendly harm reduction guidelines, which would be the first of its kind. And last year, we got to inform these guidelines by having a 2023 youth consultation, which we brought together all of the researchers and the key movers and shakers in youth-related harm reduction to talk about what is the state of affairs when it comes to access to harm reduction for young people, and also what does drug policy look like and its impact on young people. So it was really fantastic to bring this together, and we hope to be able to share those guidelines with you when they come out. So I think that's me at time. Thanks so much for having me. It was really exciting to talk about these platforms. And if anything is confusing for you, please do reach out. We would love to bring you into this movement. We need more people talking about young people who use drugs and our access to human rights. Thank you.
Thank you so much, Ruby, for this excellent presentation and for being part of the movement that is pushing the boundaries for more progressive and more inclusive drug policies. So you are part of this really progressive movement that is pushing for the rights, the recognition of the rights of people who use drugs and the meaningful engagement and of young people and policies related to the harm reduction and harm reduction education. We look forward to the youth-friendly harm reduction guideline, and also we look forward to support this development. Our next speaker is Daphne from Choice for Youth and Sexuality. And Daphne, please, what are the key themes that emerge from this year's ayCPD dialogue, and why the dialogue in Benin was important, and particularly for the youth movement? And finally, tell us about how has Choice leveraged its participation in the ayCPD plus 30 dialogue to influence policy and programmatic decision. Daphne, the floor is yours.
Thank you so much. Hello, everyone. It's a pleasure to be here. So I'm here with the next slide, please. I'm here with on behalf of Choice for Youth and Sexuality, which is a youth movement based in the Netherlands, and that works mainly on sexual reproductive health, rights, and justice. And we're working in about 11 different countries. The advocacy points that we have are quite broad and try to cover a large spectrum of what sexual and reproductive justice can stand for. And we'll go a little bit more into it as I dig into the ayCPD plus 30. Next slide, please. So you might not be very familiar with such an opaque letters, but the ayCPD stands for the International Conference for Population and Development, and plus 30, it's because it's been 30 years now that it happened. So initially, it's a conference that took place and that really put sexual and reproductive health and rights at the center stage of global discussions on health and human rights, really affirming that sexual rights are human rights. And I think it was a very big momentum, and it changed a lot of things, and it created a program of action to make sure that sexual justice would be achieved. So now it's been 30 years, and it's moment to take stock on what we've been able to achieve and what the path is that lays ahead. And to enrich this discussion, UNFPA has convened a global youth dialogues, which took place this year in Benin, to convey how important it was that young people participated to this discussion. So the global youth dialogues were mainly with youth-led organizations, almost exclusively young people, to discuss how these topics affect us and how we want to bring our advocacy to the next stage. So this was a pre-meeting that took place before the actual ayCPD meeting in New York, and our goal was very much to make sure that the voice of young people would be heard there. Next slide, please. So why was this such an important moment and a very important meeting? It is because it's the first time that so many young people are conveyed in a space that is specifically meant for them and meant to discuss the topics that are relevant to their lives. So I think it was a huge acknowledgement of everything that they've been doing for the movement. So by the very fact that it exists as a space, it was an acknowledgement, and I think it also helped with liaising different types of movements that don't necessarily always talk to each other, either because of the geographic scale and how it's difficult to create bonds, but also because they have different scopes. They're interested in different topics, and also they're from different sizes, from certain really grassroots organizations that struggle to secure funding to big international youth-led organizations that have been on the global stage for a long time and putting us on an equal footing and creating a space for us. Some of the important topics that were touched upon were comprehensive sexual education, rights and justice, namely when it comes to inclusion of people with disability, people from different races, people from indigenous community, etc. the access to services, namely contraception and other health services, namely abortion as well. And two other topics that were very important as well were the access to funds. So this was a little bit less conveyed in the external communication about the event, but in my experience, it was very much discussed. It was how can the global development infrastructure make sure that youth movements can thrive and can have a chance to exist and expand and learn, especially for movements that are first-time grantees, because making this first leap can be quite difficult. And then there is the question of peace and resilience, because you're all aware of the situation that we're facing globally. And I think that is very important for us as young people. We're thinking about the resilience that we have and how we can, be part of a positive movement to foster peace. When it comes to HIV is less at the forefront of these sexual health discussions in an explicit way, but obviously it is a part of all these topics. So I think for me as an HIV advocate, it's very much about bringing it into the discussion. By, for example, if we're discussing access to contraception, it's getting people excited about research on the dual pill, or talking about harm reduction awareness and approaches in sexual education. Next slide, please. So obviously, we're going to these events because we want them to have an impact on the policies that we can make within our own organizations and with our partners, and also to have an impact on our programs. So to give you a little bit of an idea of how we can make these spaces count, I want to share with you how within Choice, it made a difference for us. So one of the first and most important things in general of attending such events is the question of representation. So as advocates, we tend to be brokers between our community space and high-level decision makers that may not speak the same language as us. And I think that sometimes we can have a hard time in making them see the importance of these experiences, especially because they tend to construe them as being limited to the groups that we're familiar with. So being able to liaise with other movements and take on board their advocacy and their experiences really adds weight to our discussion with high-level political decision makers. For us in Choice, that was especially important in our relationship to the Dutch government, which is both our own government and also a big donor in the field of SRHR, one of the biggest bilateral donors and one of the co-organizers of the event in Benin. And so for us, it was the occasion to foster that relationship, to show them, the results of these discussions, and also liaise with the embassies there, etc. So that was for our longevity as a movement, that was also important. And then there was also having our capacity built on different topics that we might not be as familiar with, or at least have access to experts, youth experts, that otherwise we wouldn't have gotten to meet. So I'm thinking, for example, when it came to trans rights, is something that we're working on, but we had the opportunity to meet experts on mental health and mental health programming for trans people, or as well as safe use of hormones, which is not something that we had worked on a lot before. Next slide, please. So with showing this experience and talking about ICPD, I want to make a larger point about the fact that there's not one way to build your advocacy. There's not one way to engage with all the different actors in the field, because there's so many of them. So I'd like to draw on this experience to contrast two organizations that I've been part of for a long time, which is Choice, as you know by now, and UAM, which stands for Universities Allied for Essential Medicines. And their mission is to ensure that universities that produce medicines sell them and license them in a way that down the line will make them accessible to greatest amount of people possible, which is often not the case. And so the first thing that I notice when I'm comparing both is that their structures and how they're organized dictates the way that they can engage with actors in the field. So on the one hand, Choice is a centralized organization with about 10 people that are full-time employed staff. So that means that they can cast their advocacy net quite wide, which is not necessarily something that UAM can do because it's more of a flat organization with different chapters and different universities worldwide. And because of that, their advocacy has to be more targeted. So that's one key difference. And another one would be, at what level you decide to engage with actors and policymakers in the field. Because, for example, Choice has always engaged more with UN agencies when it came to sexual reproductive health, so namely UNFPA, the Human Rights Council, and on the other hand, UAM, even though it's part of the WHO Youth Council, has been always more looking more down in this chain, let's say, at local decision makers and mainly decision makers in their universities and working their way upwards from there. And it's different ways of engaging with this very, very wide web, and it's about mapping a road in who is the node that you want to make move, so that your advocacy points works out and that you can have the impact that you wanted. So that was it for me. So thank you very much for your questions, Alicia, and for your attention, everyone.
Thank you very much, Daphne, for this overview of ayCPD and the strategies that led to successful inclusion of youth priorities in the ayCPD outcomes. And also, thank you for ensuring that youth-related priorities are also part of the ayCPD discussions. I just want to remind before going to our next speaker that all participants can post your questions or comments in the Q&A box that's at the bottom of your screen. Feel free to put there your questions or any comment you have regarding these excellent presentations. Following the agenda, let me invite Agatha from Youth Lead to take the floor. Agatha, please share some insights on how Youth Lead's initiative in Asia and the Pacific regions have successfully influenced policy changes to improve health outcomes for adolescents and young key populations. Also, please share with us the key strategies and practices that you found most effective in ensuring the successful inclusivity and engagement of young key populations in the Global Fund related processes. If you have also any lesson learned or best practice that you would like to share, please feel free to share it here. Agatha, the floor is yours.
Thank you so much, Alicia. Good evening, morning, afternoon from wherever you are. My name is Agatha. My pronouns are they, she, and I work as the project officer for Youth Lead Asia Pacific, the Asia Pacific Network for Young Key Populations. We are based in Bangkok. So yeah, let's get into it. Next slide, please. Okay, so I'm going to start with the Global Fund replenishment, which according to the official Global Fund website is the world's opportunity to rise to the challenge and take bold action to protect everyone everywhere from the deadliest infectious diseases, which under the Global Fund fighting for AIDS, tuberculosis, and malaria, And the replenishment process typically occurs every 3 years and involves a series of meetings and negotiations where donor countries and private sector partners and other stakeholders pledge financial contribution for the upcoming funding cycle. Next. Okay, so YouthLead has a lot of examples when it comes to our work in trying to improve health outcomes for adolescents and young key populations in the context of policy changes in Asia Pacific. But I would like to highlight these two work that we have conducted. First is the TeenGen version 2 pilot training in Vietnam. So this year we have upgraded our TeenGen manual, which is the leadership training for adolescents and young key populations focused on those under 18 years old. First developed way back, but we have just updated this year, and we have just conducted the training, the pilot training in Vietnam from 12th April to 4 May this year in collaboration with the Department of Education and Training, the People's Committee of Chiang Mai Commune, and Tu Nang Secondary School. So the training was attended by the total of 103 participants and 43 in-school learners. And we had a lot of fun, and we conducted this training together with the Vietnam Young Key Affected Populations Network. So after this training, the VYCAP are focused on providing this module, the TeenGen module, to teachers, teaching students and adolescents to help them enable themselves to utilize and ensuring that the key populations in the school have safe spaces to become the leader of our movement themselves, and with VYCAP committing to provide the technical support as needed. And next is the regulation of the Minister of Health of the Republic of Indonesia, number 23 of 2022 on HIV and STI management, which allows adolescents under 18 years old in Indonesia to access HIV testing services without parental consent. So they could be accompanied by adults, usually the outreach workers working under the Global Fund projects in Indonesia. And this, ever since the release of this regulation, it has increased accessibility, provide more privacy and confidentiality to adolescents and young key population accessing the HIV testing services. This also helps more education and awareness to ensure adolescent-friendly services, and also in the process, we ensuring the community engagement. Next. So this is our main strategies for youth engagement in grant allocation. First is the capacity building for youth organization, because the Global Fund process are so technical and so long, especially in the replenishment process, for example, in the GC7. So we have to make sure that our focal point in the country level are aware of what do they need in order to be able to meaningfully and actively engage in those country level processes. We also provide leadership training programs, as we have mentioned, for example, TeenGen. We also encourage active youth participation in governance. For example, in Indonesia, YouthLead supported the discussion internally with 10 provincial members of Inti Muda Indonesia, the national network of young key populations and young people with HIV in Indonesia, but also to conduct the discussion with the national stakeholders, the government, the fellow HIV and Human Rights Network, and also the UN agencies, we also provide online communities and forums. We regularly conducted exchange learning and webinar, especially now we have the new platform of 7 Alliance, the 7 regional networks of of key populations and people with HIV in Asia and the Pacific. And we also provide funding and resource access. And we have granted more than a cumulative total of $1 million to various Yonki population organizations across Asia and the Pacific. Next. Yes, so thinking about everything that we have done so far in terms of advocacy, I think these 3 points are the ones that I can highlight in today's webinar. Is first, we have to know our resources as ayKP-led organization, because I'm sure this is not something that only a problem in Asia and the Pacific, because this is a systematic, specific problems for years that ayKP-led organization always faced with the limit of resources. So it is very important for us to first aware of what do we have, and then to be able to maximize and utilize what we have to have the best optimal advocacy work. And then we also have to know the actors impacting our advocacy work. Map your allies and opponents, because there are some people who are very excited to see ayKP to be the part of the leaders team, to be the part of the policymakers, to be a part of the change, sitting in the driver's seat of the HIV movement in Asia and the Pacific. But there are also others who does not feel happy with the movement because of various reasons. So this is very important for you to connect with your allies, ask for the supports in order for you to overcome the opponents and their work in trying to discredit the ayKP movement. And then last but not least, and this is very important, to have the advocacy roadmap. So not only you can measure the impact of the work that you are doing in advocacy, but we can also identify unpredictable changes, because we know the social, economic, and cultural pressure and processes, specifically in Asia and the Pacific, as we're speaking, are moving in a very rapid speed. So it is very important to have a roadmap so we can sort of like track where are we right now, and do we need to make changes in order to move forward to the next. And I think for these 3 to be able to work smoothly with each other, we have to remind ourselves to stay kind, especially towards each other, towards fellow young people, because it is very hard sometimes to notice and to be aware of the power imbalance within the ayKP-led movement itself. So it is very important for us to know our strengths, our resources, know our allies, our opponents, and to have the advocacy roadmap for whatever's advocacy work that we are doing. And I think that's it for me. Thank you so much for the opportunities for me to share with you all. Feel free to discuss with me, and also I cannot share everything with you all tonight, so feel free to connect with Youth Lead to our social media. We have we have Facebook, we have Instagram, we have our website, and we have our LinkedIn. Youth Lead Asia and the Pacific. See you there. Thank you so much. Back to you, Alice.
Thank you, Agatha. Thank you for sharing your knowledge about the strategies for meaningful adolescence and youth engagement in global fund processes. As you mentioned, advocacy and access to sustainable funding is really critical for moving this work forward. and also alliances with strategic partners is key. And finally, you mentioned a really important point about having clarity on your advocacy priorities, which is really really important. Thank you for highlighting those points. We have finalized the speaking part. I will now open up the floor for those interested in asking questions to the speakers, and also making comments or commenting any of the different topics and thematics that have been shared by the speakers. So please feel free to raise your hands.
Thank you so much, Alicia, for being the moderator here. So I see in the Q&A chat, we have great presentation. I and my team are very much interested in getting slides and associated materials. Thank you so much, Agatha, for responding to that. The pleasure is definitely ours to be able to share the experiences with you and all of the participants today. After the webinar, we will be sending out more information on how to access the recording, as well as the resources that has been shared by all of our speakers today. And then if we also have any additional questions from anyone, please feel free to post that in the chat. I know I myself have a couple of questions, so I can start us off. So for Ruby, thank you so much again for just really your insight on CND and the impacts. So the first question that I had was, what are the main challenges currently facing the CND in its mission to combat drug trafficking and abuse? Over to you, Ruby.
Thanks, Bukola, for the question. I hope you can hear me okay. So yes, to remind people, the CND is the global decision-making body for drug policy. And I guess when it comes to the challenges it faces, one of the main ones is that it's the basis for the drug policy, the global drug policy, and the conversations around it for so long have been criminalization and making policy advancements that are doubling down on criminalization and punitive efforts that aren't working and are causing more harms to people, not just those who use drugs, but when it comes to those involved in the drug trade and young people who are working in the drug trade as producers and also exploited by gangs. So it's really, the CND is kind of facing an identity issue from our standpoint, in that it is created to respond to drugs as a global problem, but tackling it with warlike approaches that do not prioritize or safeguard the health and human rights of people. So its biggest issue, I think, is in its identity, and how to integrate harm reduction and promote harm reduction within punitive policies, which I think they're realizing, and the governments attending the CND and decision makers in this space are realizing they don't go hand in hand, and efforts need to be put into being person-based and health-based and human rights-based, as we're seeing now more human rights bodies engaging in the conversation. I think it's starting to become a reality to those within this drugs decision-making body that ending drug use is never going to happen. And ending the existence of drugs is never going to happen, which is the mission of the CND and responding to this issue in its sense. So yeah, I think the biggest challenge for it is now how to shift away from punitive and promoting punitive responses that have not worked, and how to welcome in more people-centered approaches like harm reduction. That's probably its biggest challenge. Yeah.
Thank you so much for that, Ruby. That is very insightful in thinking about how missions that have, you know, been in place for an organization and then rethinking and re-strategizing our efforts. I also see we have a Q&A in the chat. Let me check. We have a question. All right. We have a question from Abidi. Go ahead.
Hello, thank you very much indeed. I'm from Somalia, East Africa. So thank you for your presentation. I'm very proud to be with you. If I come to my question, so in my country, so if I wanted to be part of this adolescent partnership, how or what will be the criteria that in order to we need to be part of this activity because of it's very important, and our adolescent community is very high. So how we can be part of this group? Thank you.
Thank you so much, Abidi. Definitely. Did one of our speakers want to interject and answer the question?
Hello. Yeah, I think that I'm not entirely sure if you're referring to a specific group that you'd like to integrate, or whether you're referring to more generally to the wider movement of fighting for these issues in general. And sorry, I got distracted by more questions on the chat. But I think that the first step in, articulating yourself, I think there's two main ways. Either you can do it individually and try to find a way to liaise with organizations that already exist in your region or who are also active online. I know, for example, that certain organizations, might be the case of some other people who presented today, also have advocates that are linked together through an online community and who are able to do community work by themselves. So that's like one route. But if you're already part of an organization or you already have a group of interested people, I think the best way then to proceed is to create a legible identity for you as a group, start doing actions at your level, and then try to liaise with other, again, organizations that are around you and that might have connections more on the global or international scale. I know, for example, for me, for my movements, that has always been extremely helpful is to find an ally. Usually it will be an adult-led organization that has this connection and that can bring you on up until the moment that you have the backbone and the structure and the experience to be able to venture there yourself. So I think organizations in your region are probably your best ally in that. I don't know if anyone else wants to add, and I hope it answers your question.
Thank you so much, Daphne, for answering that question. I will be also very mindful of time. We'll take our last question from Tung Dohan, who says, "Thanks for the great presentations. You all are doing amazing. It seems that we have intersecting efforts from different actors. What do you think we should do to make sure these efforts complement each other, optimize resources we have, and contribute to shared goals?" Thank you so much for your question, Tung. I will open it up again to our speakers if anyone wants to answer first.
Yeah, I could try, Bukola. Thank you, Tung, for the question. I think from our experiences working with Yonki populations in Asia and the Pacific, we really have to speak the same language, not language like in like a literal definition, but to aware of how does Yonki populations works, because the way we move in our movement are so impacted by everything that has been or currently going around us. So it's very important to understood every context that impacted the way YKP works in Asia and the Pacific, for example, so that you know that at least you can sort of like try to understand first. And then, of course, sharing. That's why it is very important for the regional and global networks to always provide the space for exchange learning, especially for the country partners, because it is our responsibility ensuring that the YKP movement around the globe are moving towards the same goal. Intersectionality, don't forget that even though maybe we are focused primarily, for example, for in a HIV movement, we are being impacted and actively impacting other issues as well. So it's very important to always connect with those who are working outside of our primary issues. And because we are working for young people, it is very important to highlight the importance of regenerations, allowing younger generations to take part as the leader of our movement. I think that's it from me. Thank you.
Thank you so much, Agatha, for that. We do have a couple more questions in the chat, and we'll be answering them live. We also have noted them as well. And I want to be mindful of time, so we can take one last question. And that is the second question that I see here. It says, there have been a lot of progress with YKP movements in the Asia Pacific region as compared to Africa. Is it possible to have a regional link and learn platform for collaborations and experience sharing? I've been pushing this for a long time, and I see, Agatha, that you've also answered those questions in the chat. So thank you for providing the email addresses. And as I mentioned, we'll also be following up to our registrar attendees with all of the essential materials and resources that have been shared in today's webinar series. So thank you all so much for that. And I will pass it along to Alicia to give us our closing remarks.
Thank you, Bukola, for moderating the Q&A session. We see that the three speakers today have shared successful examples of youth engagement and leadership in the global health advocacy infrastructure. And we know from the key messages presented in today's sessions that youth-led networks must be supported to continue leveraging opportunities and continue influencing these and other critical policy and decision-making spaces. UNAIDS, jointly with Y+ Global, and also with engagement from young leaders, youth networks, UN agencies, and a few allies from governments, from different regions and levels, have tried to systematize best practices and recommendations in a framework called Youth Next Level, which is a suite of resources developed to guide key stakeholders in their efforts to scale up and institutionalize youth-led responses. So the result is a guidance document, which includes the definition of youth-led responses and youth-led organizations, which was developed through a consultative process among youth networks and led by the Pact. So these definitions are really critical to ensure we are able to measure progress to achieve the 30, 80, 60 targets on community leadership that are included in the 2021 Political Declaration on HIV and AIDS, and also critical to measure youth engagement and youth contributions in the HIV response. So Youth Next Level also provides an overview of the principles for meaningful youth engagement and also the barriers to meaningful youth engagement, and provides practical recommendations and examples to put these principles in practice and overcome the barriers that hinder youth engagement in the HIV response. Meaningful youth engagement continues to be key for the implementation of the next phase of Youth Next Level. So you will hear from us very soon about how we can continue partnering in these efforts and what role your organization can play in promoting and advocating for the strengthening of sustainable youth-led responses. So thank you to those who have worked hard to make this series of webinars possible, starting with UNICEF colleagues, Lola and Bukola, also Garrett from UNAIDS, and to the wonderful speakers we have had today, who have really illustrated the passion and dynamism within the youth-led responses. And finally, thank you to the ayKP Partnership Steering Committee for driving efforts for social justice towards a young key population in the HIV response. Thank you all for participating and have a great rest of the day.